Dr. Vuong, I want to talk to you about sleep apnea, something which apparently is in the news lately quite a bit. People apparently are driving down the road, having accidents, falling asleep. Literally, they pass out simply because throughout the night they haven't slept the way they thought they slept. It's called sleep apnea. Most people, not all, but most people who snore have it. And dentists seem to be an enormous, phenomenal source of fixing that. Tell me all about it.
Well, yeah, sleep apnea is just a condition where a person goes through oxygen deprivation while they're sleeping. Just all of a sudden they stop breathing, and some patients can die from that. But a lot of times patients just simply wake up, they can't sleep because of the oxygen deprivation, and they wake up very fatigued, tired, and irritated. And but all of this can be fixed with a simple appliance that we make in dentistry.
Okay, and that simple appliance is kind of like like a mouth guard, kind of.
Yeah, kind of like a mouth guard. It's basically kind of like two mouth guards, one for the top teeth, one for the bottom teeth, and there's a little jig that kind of connects the two pieces, that puts the lower jaw in a forward position, which opens up the airway. So it prevents the airway from collapsing, and therefore it kind of I wouldn't say cures sleep apnea, but it's
while you wear the appliance, the airways are open, and you will sleep through the night where you otherwise don't.
That's right.
It's a little bit, I guess, sleep apnea and the appliances with sleep apnea, whether you use what's called a CPAP machine, which is a machine which presses oxygen into your mouth, just room air, basically, not oxygen, it's probably a wrong word, which apparently is a very good thing to do, except most people can't stand it, and, they need to lay on their back, and it's they just can't stand it, so they don't get up, wear dislike things. So anyway, any appliance you use for sleep apnea is a little bit like with glasses. If you don't see without glasses, you put them on, you see. You take them off, you don't see. It doesn't cure your sight, but while you wear them, you're fine. That's, I guess, how it goes with sleep apnea appliances, right?
That's right. That's pretty much it. Recently, I've had a patient that used the CPAP, but he didn't like it. He couldn't really wear it that well, and he forced himself to wear it, but there was one side effect with it, because it kept pressing right on his front tooth. It kind of moved his front tooth backwards, and so now he looks like he has buck teeth, and he didn't like that.
No, nobody would. Well, the fact is, I mentioned in a couple other videos that, my wife is one of the most dedicated women persons, period, I think, when it comes to when she thinks she must and should do something, whether that's keeping her skin pretty, whether that's whatever it is, brushing teeth, chewing, name it. She hears about it, she learns, it makes sense, and she will do it religiously. Now, she found out about sleep apnea, and she put one of those CPAP machines up, and I'm telling you, if my wife, who tried it for 3 months, can't stand it, and slept less with the damn machine than without it, I can understand that it is difficult, because my wife, she's willing to do anything if it helps. So she got one of those dental appliances, and even though they had to be slightly adjusted once or twice, a little, it kind of like hurt her for the first week or so, not hurt, but be a little bit more uncomfortable. After that, fine, dandy, good, and even while she was hurting, she already slept. She felt the difference almost immediately. She did a test, and the doctor told her, because we're both long sleepers, we love to sleep 8 hours and plus. And they said, yeah, you think you sleep 8 hours, you sleep not even 3, they told her in the test. Tell me, this sleep test, does everybody need to take it? Or if you wake up tired and exhausted, irritated, If you feel asleep in the afternoon and feel like taking a Red Bull and taking a cup of coffee or any other type of pick-me-up thing in the afternoon, doesn't mean you have sleep apnea, but it could well be, and would be if everything else is exhausted and if on top of it you snore, which is a large indication that you have sleep apnea. Would it be just okay to go get that appliance, which is really rather inexpensive, and basically realize simply that you next morning, literally, you wake up and go, wow, I'm rested.
Yeah, it would definitely make sense. I mean, if you don't necessarily have to have a diagnosis of sleep apnea to have the appliance. If you get the appliance made and you wear it and it works for you, well, great.
Exactly, because if you are tired, exhausted, irritated, feel like needing absolutely a nap in the afternoon, despite the fact that you, had your normal sleep, so to say, then it may be, and especially if you snore, because even if you don't for some reason have sleep apnea, keep in mind, at least that's what we should be keeping in mind, that we don't hear when we snore. It's our partners who hear it.
That's right.
Even if they snore themselves, it's their snoring so they wake each other up, right? Kind of, and right there, that's not healthy. So even getting rid of the snoring alone for the sake of your partner, never mind sleep apnea. But as I said, accidents in New Jersey, a guy just dropped a bus around the bowl and killed people, and they suspect sleep apnea being the case. So a good thing to do. Anything else we need to know about it, or can we end this conversation about sleep apnea?
Like you said, I think a sleep apnea appliance can really be just a snoring appliance. So if you snore, even if you don't have sleep apnea, if you just get the appliance, it'll at the very least stop the snoring, and your partner will have a great rest, and you will have great rest too.
And that's really what it is all about. As I said, my wife, and she apparently had a mild one. They told her that she wakes up to 10, 12 times per hour.
Wow.
And they call that mild. So, and now she sleeps better, sleeps like a baby. By the way, she needs to go less to the bathroom. Because apparently, as you sleep light, constantly in the awake state, any tiny little pressure, you feel like, okay, I gotta go to the bathroom. So you think that's it, why you woke up. But it's really not why you woke up. Make sense?
Yes, definitely.
Yeah. All right. Well, good. Thank you very much, Doctor. Lots of happy spouses will be out there not having their spouse snoring. And probably tell the other guy, you get it too. Like my wife did with me. Thank you very much. Bye-bye.
Thank you, Helmut. Bye-bye.